So really nice to be here in the Paediatric conference today. I work in Oxford. I'm a dermatologist, a paediatric dermatologist. I work closely with lots of teams, but particularly today I'm talking about some of the patients I see with the gastroenterologists. Now, as I'm sure you're aware, a lot of drugs are now being used, medications for significant inflammatory conditions such as inflammatory bowel disease in paediatrics. And one of these medicines is a biologic called an anti-TNF. This has been used since the 90s for treating inflammatory bowel disease and probably since the late 90s, 2000s for treating a different condition called psoriasis in paediatrics. Now what we've been seeing over the last 20 years is increasing numbers of young people having skin problems when they're being given such medications for a different condition such as their bowels. And those problems can be really significant and we're seeing them quite commonly. And so what I'm talking about today, or what I'm telling you about today, are how to recognise those skin conditions, and that although they've previously been termed paradoxical psoriasis, we now realise they're not so paradoxical. In fact, we almost expect them to happen in a proportion of young people and children. And there are things that can be done. So certainly recognising that these skin conditions can happen, warning your patients that they can happen, and managing them alongside a dermatologist often. And that can be just topical treatments, or it sometimes can lead to a change in medication. And I think this is really important because it's increasing our understanding of how some of these new medications are altering your immune pathways, expecting some complications. And as we increase the number of medications we use, we're going to see more such problems. And so we all have to work closely together to both inform our patients and manage our patients successfully.